everybody. I'm Rachel Hopkins. I'm the HCS Program Director here at Ability Connection. We want to thank you all for coming to this important STAR Plus session. We have the privilege of having Debbie Little-Smith. She is the Senior Project Manager for Health and Human Services Committee. So she will be here to explain the STAR Plus to all you guys and be available to answer any questions. Okay, so I will turn it over to Debbie.
Good afternoon.
Good afternoon.
Ooh, enthusiasm, I love it. First of all, let me apologize that Gary Jesse wasn't able to make it. He was called to the Capitol at the last minute, so I'm probably having a lot more fun than he is at this point. But I'm hoping that I can answer at least the majority of the questions. I don't pretend to have the knowledge or exposure that Gary does, but we're going to do a good job and get your questions answered. So how many of you are in the HCS program or support somebody in the HCS program? Okay, quite a few. Great. How about Texas Home Living? I think you're the Lone Ranger.
We're CDS.
Okay.
They were direct service.
Great, okay. And class? And let's see, we are also a class case management agency, right?
Yes.
Now, did I hit any ICF people? Okay, we have 2 Lone Rangers. Okay. I know a lot about HCS. I spent a long time at DADS. I was over those surveyors that I know you look forward to talking to occasionally. And I know a lot about Texas Home Living because that was the same group of people that did the surveys. I'm learning a lot about class, and back in the early 80s I worked in ICF, so it hasn't changed as much as many of the other programs, so I think together we can get through this. I'm going to focus on STAR Plus because our focus today, unless somebody isn't going to have their needs met, is going to be talking about those 5 programs. And those 5 programs are commonly referred to as IDD programs. So programs for people with intellectual disabilities, intellectual or developmental disabilities, IDD. I say that because it's really, really important for you all to know that there are other people who have IDD that aren't in these programs. There's 65,000 people waiting for HCS alone. And some of them are already in STAR Plus. So anybody support somebody that's already in STAR Plus? Okay, so you're all associated with those 5 programs. Okay. People get confused by that, so I just wanted to point that out. You have this PowerPoint. At your leisure, you're welcome to look through it. A lot of stuff is just general managed care information. There's also information about the other managed care programs, but we're not going to really spend much time on those today. But if you want, for your own curiosity to look at the PowerPoint and learn more about those other programs, certainly feel free to do that. We have been going around the state educating families and people who are going to be affected by the STAR Plus enrollment about the STAR Plus program, and also who's included, who's excluded, and we're going to talk about that today. We also have a video that we're going to show that we think will help explain who's going to be involved in the STAR Plus program and who won't be. And I'm really curious to have your feedback on that video too, to see if it was. Okay. Well, let me ask just one more question. Is anybody from a rural area? Are you, okay. What county?
The Wichita Falls area.
Okay. Okay. So in the Medicaid rural service areas, in those rural areas, people that are enrolled in the HCS class deaf, blind, multiple disabilities waiver, and Texas Home Living actually enrolled in the STAR program back in 2012. So there are some people who are not going to be new to managed care. They're going to be new to the STAR Plus program, but not to managed care as a whole. Okay. So today we're going to talk about what managed care is, how it's being expanded, and we're going to talk mostly about the 5 programs that you all are representing. We're going to talk about what you need to do in order to educate yourself and get ready for these changes and what these changes will mean to you and the person you support. And then we want to leave lots and lots of time for questions because it is not simple, it's not intuitive. Once again, we've made it as complicated as we possibly can, just for your benefit.
Yes.
So we're hoping to untangle that web for you today. This presentation is available at that website in case you ever want that to look at it or print it off or whatever. And this particular presentation should be on that website. We've had several revisions, but it should be up to date at this point. So let's talk about, first of all, what managed care is. I really think of managed care as kind of being an insurance policy because you're going to be working with one agency for all of your health care needs. And I'm just going to say your health care needs, knowing that some of you support somebody that's going to be enrolled in STAR Plus. For these 5 programs, and I'll talk about 5 programs rather than going through the whole list, the people enrolled in those programs are going to get acute care service only through STAR Plus. So when we talk about acute care services, we're talking about medical type services. Doctors, specialists, prescriptions, hospitalizations. If somebody has an accident, there may be short-term therapy that is provided through acute care services. A few adaptive aids if there's been an accident. But generally it's that health care type of service. The people in the 5 program are going to continue to get their other services, what we call long-term services, exactly as they do today. So you're enrolled, or you or your loved ones enrolled in HCS, they can continue to live where they're living today. They will have the same people supporting them, whether it's you as a foster companion care provider, now called a host family, or whether somebody comes into your home to provide supports, or whether they live in a group home. So those services are going to remain unaffected. You know, you'll have a nurse if you're in HCS that may be working with you. That whole array of 18 to 20 services in each of these waivers will remain unaffected. So that's often the first question we get. The goals of managed care are to focus on preventative care. And I've actually been really impressed that there is a focus on preventative care because historically in Texas we've been very reactive. We wait until something happens, a crisis, and then we run in and try to intervene. Managed care organizations are benefited by thinking ahead and trying to prevent medical crises. And you can understand that. If somebody can be prevented from having a hospitalization or a psychiatric breakdown or whatever, the member wins, the person that receives the services, and also the managed care organization wins because they're not having to put out a large amount of money to serve that need. I am going to talk about the people who are going to be enrolled in managed care first. I'm going to gradually introduce you to managed care language. So members are just somebody that's enrolled in managed care. We're hoping that access to care will be improved. Every managed care organization or every health plan has a network of providers, just like our insurance companies. So there are lists of doctors according to specialties. There's a list of family practitioners, there's a list of dermatologists, there's a list of neurologists, whatever. And so we're hoping that that will make it easier to find a doctor that will serve the member. I don't know how it is in Dallas. I know in parts of the state, doctors that will accept Medicaid are few and far between. You have that problem here? Especially psychiatrists, neurologists a lot of times. Yeah, it is a challenge. So we're hoping just having that directory will help people be able to identify doctors or specialists that can provide that service. We're hoping for better health outcomes because if it's easier to access health care, we hope that, again, there will be preventative measures taken and people will enjoy better health and a better quality of life. And I don't want to overlook cost effectiveness because, as I mentioned before, there are 65, I think maybe 67,000 people now just on the HCS interest list alone. I think there's about 25 or 30,000 on the class interest list. So if you add it all together, we have over 100,000 people in Texas awaiting services through one of these waivers. So a lot of people waiting. If we can provide more services to more people for the same amount of dollars, it's a win-win situation. The managed care organizations, and this is not for your long-term services, they won't be involved in those services that you put on the plan of care, but they are medical services are used appropriately. So they do have a utilization review function. They're going to be evaluating the needs of their members and what they need as far as their health care goes and making sure that member gets those needs met. But they are also cautious not to over-provide health care to somebody that doesn't need it. And I think most people already have a main doctor, but the managed care organization does identify a main doctor for each of their members. It's kind of like our primary care physicians if we're involved in private insurance. Everybody will have a named doctor. The question was, does the member select the main doctor? What we are working on, and we are really encouraging the managed care organizations to have as many physicians in their network as possible. And we've actually, through our billing system, we have provided the managed care organizations a list of all the primary care providers and all the specialists that are used by people in these 5 programs. Because we know, usage is a little different than just the general population. So they're actively going out and outreaching to those doctors to be involved in their network. Recognize that it takes 2 people to enter into a contract, even though the managed care organizations may be reaching out to a physician may say, no, I really don't want to contract with you. And then the managed care organization is going to say, but how about if you contract with us for just one person? We call that a single case agreement. Single case agreement. Or they could do it for an ICF home, only the people that live in that ICF. So generally it's for anybody that's a member, but a physician can limit the contract to one person or a smaller group of people. We are carefully monitoring the networks of the managed care organizations as they develop them, because we want to make sure their networks are robust and they are prepared to serve the people in these 5 programs. There are actually 5 managed care programs in Texas already existing. You've probably heard of some of them. STAR is primarily for pregnant women and children. However, in the Medicaid rural service areas in those 164 rural counties in the state, people in class HCS, Texas Home Living, Deaf, Blind, Multiple Disabilities waivers, if they were Medicaid only and if they were adults, were required to enroll in STAR back in 2012. Those same people will be now required to enroll in STAR Plus. So they have another decision heading their way. STAR Plus is the program we're going to talk about primarily today. STAR is acute care only, so it's health care only. STAR Plus is both acute care and long-term services and supports, except for the people in these 5 programs. So people outside of these 5 programs that are enrolled in STAR Plus can also get attendance services through the STAR Plus program. They can participate in a day activity and health service or an adult day hab center through STAR Plus. And they can also receive what used to be called CBA, which is a waiver for people that meet the requirements to live in a nursing facility. STAR Plus has integrated all of those services. We call it the STAR Plus waiver, but it's pretty much identical to the CBA waiver of the past. Effective September 1st, 2014, there will no longer be a CBA program. All of it will be absorbed into STAR Plus. There's also STAR Health, which is a managed care program for children that are in CPS conservatorship, so it's a small program. There's CHIP, which is managed care for children whose families make a little bit over the income allowance for Medicaid. And then there's CHIP and Children's Medical Dental Program. And that's a dental maintenance organization that children and young adults that are in the waivers, the 4 waivers, Class HCS, Texas Home Living, and DBMD, they're already enrolled in a dental maintenance organization. So they're getting managed care dental. You may or may not know that. I want to talk here, we talked about most of this already, but all of the managed care organizations are required to provide the same benefits as traditional Medicaid. So those benefits that you used to get through your Texas Benefits card or the Medicaid card, they are required to provide all of those benefits. In addition, they have what's called value-added services, and that is a service or multiple services that are selected by the managed care organization to try to recruit membership. So, for example, every managed care organization has to offer traditional Medicaid benefits, the same health care, but one managed care organization may offer sports physicals for children and young adults because traditional Medicaid doesn't pay for that. So maybe that's one of their value-added services. A common value-added service are routine dental cleanings for adults. As we all know that regular Medicaid doesn't pay for adults, which is a thorn in all of our sides, I think. So that's a very popular one. They may pay for summer camps or gym memberships. Anything that promotes health or is related to health care could be a value-added service. All of them have to be approved by HHSC, so there's nothing too outlandish. You know, we don't go for a big screen TV, helps eyesight or something. But, you know, as long as it's a health benefit, we will at least evaluate it. So when you start receiving your information, you're going to have a page in your packet that lists all of these value-added services so that you can evaluate which of those best meet your needs, because the other Medicaid benefits are to be very similar. Okay. Once a person enrolls into managed care, any type of managed care, they're going to get yet another ID card. So a member is going to have your Texas benefits card, and then on top of that, they're going to have an ID card from the managed care organization they have selected. And if they're a child or young adult in one of the 4 waivers, they're also going to have a dental card. So I think of it kind of as a Las Vegas dealer where they can go to a doctor and just pull out the cards and say, pick the one you want. But each of them really do have a purpose, but there will be another one. And that ID card will include the managed care organization's names, the main doctor's names, phone numbers, kind of like an insurance card. We're not going to talk about STAR. Just realize that in the future it's going to be for pregnant women, infants, and children from low-income families. The people in the 4 IDD waivers will be going into STAR Plus effective September 1, so they'll no longer be in STAR. This is the Medicaid rural service area, so the colored areas, the blue and kind of army green and purple, those are the counties where the people in the 4 IDD waivers are already enrolled in the STAR program. Each person that is a candidate for STAR Plus, and we call that, if somebody's eligible to enroll in STAR Plus, we call that a candidate. We have mandatory candidates, and then we have voluntary candidates. And a mandatory candidate is going to be people in the 5 programs we keep talking about that are Medicaid only and do not receive Medicare. If a person is Medicaid only, enrolled in one of those 5 programs, but they're a child, they're under 21 years of age, they can voluntarily enroll in STAR Plus, or they can remain traditional Medicaid. Okay, so children are voluntary. People that receive both Medicare and Medicaid are excluded. If you are a HIP member at this point in time, HIP members are excluded from STAR Plus right now.
Oh, okay.
Right now.
Okay, that's not
Yeah. If you're not a HIP member and you have private insurance, which is pretty common, you would enroll in STAR Plus. Your private insurance would still be the primary payer, but the STAR Plus program would pick up anything else. So HIP is critical. Whether you're in STAR Plus or whether you're excluded from STAR Plus as a HIP member, you will still have access to Medicaid diapers and other services. Yes. Yes. Okay. I am not going to really talk about long-term services and supports because I think that's confusing because you guys aren't going to get long-term services and supports through STAR Plus. Recognize there's a whole bunch of other people in STAR Plus that get a different array of services than the people in these 5 programs. It talks about having some pilots to pilot the managed care organizations providing long-term services and supports. And it also talks about decisions being made on whether those pilots were effective and whether Texas wants to go that direction. It even gives dates. It says by 2017, a decision needs to be made about Texas Home Living and the long-term services and supports provided through Texas Home Living. And then for the rest of the programs, it's 2020. So we haven't done the pilots yet, so it's kind of premature to predict, I think, what will happen. Okay. These are the current STAR Plus service areas across the state. The canary yellow are the Medicaid rural service areas, but you'll notice that until September 1st of coming up, the STAR Plus areas were really the urban areas. And they were generally a populated county and the surrounding counties. But come September 1st, the whole state will be Star Plus. So that's another expansion that's occurring. Okay. Star Plus right now has more than 400,000 people enrolled. It will be probably over 500,000 come September 1, or roughly 500,000. So it is a growing managed care program. I'm going to go back just a second and talk about the people that are not in the 5 programs, because I get a lot of questions about this. There are many, many people who have intellectual and developmental disabilities that receive Medicaid, and they are, if they live in an urban area, they're already enrolled in Star Plus. If they're in a rural area, they too are going to be enrolling in Star Plus come September 1. But the difference is those people are eligible for both acute care services and long-term services through Star Plus. If they receive Medicaid and they get a small Medicaid or a small Social check, but they're still Medicaid eligible, they could actually be dual eligible and in Star Plus for those people not in those 5 programs. So I'm sure you have friends that are waiting for services, and they may very well ask you about, how it affects them. So Medicaid eligible people that are not in the 5 programs, if they're an adult, will be required to enroll in Star Plus if they're not already there. One of the things I want to talk about are, and we've been working very, very closely with the managed care organizations, trying to make this a seamless process for everybody, and it's quite the challenge sometimes. But I have to say the managed care organizations are really, really interested in learning about these 5 programs and the people that receive them. And so we've spent a lot of time educating the managed care organizations, and they're in the process of hiring people that have experience in these 5 programs so that we can all be speaking kind of the same language. One of the things the managed care organizations have agreed to do is actually name a service coordinator for each of the people in the 5 programs that are in Star Plus. When they talk about service coordinators, they are talking a little different type of person than what we think of with local authority service coordinators and case managers. But they will have one person that is coordinating the acute care for each member that's in these 5 programs. So if I'm a QIDP that works for an ICFI ID facility, I'll have a contact person at the MCO that I can work with to make sure the resident I'm serving gets what they need through the managed care organization. So we were really pleased with their willingness to do that. I just want to mention this. There's a couple other changes that are happening September 1 that are for all Star Plus members, regardless of whether they're part of the 5 programs. This also affects the STAR program. But additional behavioral health services are being added to the STAR Plus. So right now the STAR Plus program provides like psychiatric care. It provides inpatient psychiatric hospitalization. It provides counseling through a psychologist or an LPC. September 1, rehabilitative services that have historically been offered through the local mental health authorities are being carved in, and also targeted case management for mental health issues. So both of those services have historically been provided by the local mental health authorities. They will now be provided through STAR Plus, but the STAR Plus managed care organizations are contracting with the local mental health authorities to provide the service. They probably won't see a lot of difference, but the whole billing process will be different. And the local mental health authorities will have a contract with the managed care organizations. What happens with managed care organizations, just like insurance companies, they get a capitated rate. So they're not reimbursed for every service that's provided. they're getting reimbursed a monthly amount for each member in their agency that they're serving. And some members will cost more than that capitated rate, some will cost less, but just like an insurance company, you know, it should even out. The people that are eligible for mental health rehab and mental health targeted case management are really the people that have significant mental illness, such as schizophrenia, major depression, bipolar, other disorders, and children ages 3 through 17 that may not have a diagnosis of one of those yet, but show evidence of a severe mental illness or emotional disturbance. So it's a pretty limited benefit to those that are chronically mentally ill. This is us, and it identifies that people who live in community-based ICF IID facilities are part of the carve-in. The state-supported living centers are not part of this. They have been excluded. And also people that receive both Medicare and Medicaid are excluded at this point in time. And the reason for that is Medicare provides acute care services, and so we don't want to have to pay the managed care organizations to provide very, very few services because they're only providing acute care to the people in these 5 programs. So that kind of makes sense. And then, of course, children and young adults are voluntary. I do want to mention there will be another managed care program coming up September 1st, 2016, which is called Star Kids, and that will be specifically for children and young adults. I'm sure you've heard that nursing facility services are going to be carved into Star Plus. That has actually been delayed until March 1st of 2015, but there will be a lot of activity around that. How many of you got an introduction letter? Okay. Most people? Okay, good. If you're eligible, you should have, if you're part of the 5 programs. We did find that when HHSC coded what information to send to Maximus, which is the agency that helps with enrollments, we erroneously sent them information for people who live in ICFs and receive both Medicare and Medicaid. So there were some letters that went out in error. It was HHSC. We want to make sure Maximus doesn't get blamed for that, but it was us. So we have sent out letters saying, you know, you shouldn't have received a letter because you received both Medicare and Medicaid. So just to be upfront about that. One of the things that we're encouraging you to do, and the letter included a page of how you can access each managed care organization's website. We want you to start looking on that website and seeing, are those doctors that are really important to you, are they part of that managed care organization's network? Recognize that, you know, that's a snapshot in time. The managed care organizations continue to expand their network, but if you can go today and they're already there, that's great. They update that website much more frequently than they do the hard copy that you'll be receiving with your enrollment packet. In June, and it should be about the middle of June, you'll be receiving an actual enrollment packet, and that will include some of the same information you've already seen. It will include that comparison chart that includes all the value-added services the MCO is going to be offering, but it will also include hard copy provider directories, which you can look up and see is that, you know, neurologists you are so fond of, are they included in that network? Again, the website is more reliable because it's updated more frequently, but we know some people don't access computers. It will also have an enrollment form, which is a form that you can complete in order to select which managed care organization you want to serve you. You can also call with that information, or you can go online and make a choice. So there's multiple ways to do that. the answers to common questions, and there will be report cards for the managed care organizations. In Dallas area, for example, these managed care organizations have been providing Star Plus for a while. So you're going to see how HHSC has rated them as far as performance goes, and that may help you make a decision. In the Medicaid rural service areas, because Star Plus is new, we don't have that history. But we'll let you know if that managed care organization that's going to be providing Star Plus in that area has experience providing Star Plus. We'll let them know how they did in other parts of the state. So that will be a link. And all of this information is in Spanish and English. So we have also, knowing that we serve many people in these 5 programs that aren't going to be able to pick up the phone or fill out a form, we've worked very closely with both Maximus, who does the enrollments, and the managed care organizations to let them know that family members may be calling on behalf, and even family members that don't have guardianship, or, you know, they may not be the legally authorized representative in our terminology, but still they're involved in the person's life, and it's okay to talk to those family members. We have a few people, particularly in the ICF program, that just have nobody except the provider. And so we have also worked out where if a resident of an ICF or any program has absolutely nobody in their life, no involved family, no friends, that the provider can provide them support in making a choice. So it's a very difficult situation. We have also worked with the managed care organizations because we've heard over and over again that a parent, or especially a parent of an adult child, will call a managed care organization to talk about a medication change or a doctor or whatever, and the managed care organization says, I can't talk to you because you don't have any legal authority. So we've worked it out with them to where they will authenticate the identity of the person by asking some questions, and then we'll be able to talk to involved families. So we think that's a huge step forward and will benefit the member in the long run. In June, you'll be getting that enrollment packet. We really want everybody to make a decision by the middle of August. If you haven't made a decision by the middle of July, you'll get a reminder letter. But by the middle of August, that's the deadline for choice. And if somebody doesn't make a decision about what managed care organization they want to support them by the middle of August, then HHSC will actually assign a managed care organization to that person. So you're in a much better position to make a choice for your loved ones than we are. However, we have talked this through, and for Medicaid rural service areas, I know I'm talking to a limited audience here, if a STAR plan has been historically providing the services, and that STAR plan is also a STAR Plus plan, if the member does not make a choice, the first round of default will be to that same organization that provides STAR Plus, because they're likely going to have the same network of doctors and whatever. We thought that would be much less disruptive to the member. For the rest of the world, outside those rural areas, what we'll do is make a match between physicians and the members' claims. So we can look in our claims information and say, well, you saw Dr. Anderson, and if we can make that match, we will default you to a plan that has Dr. Anderson in it. So we're trying to eliminate as much disruption as possible, but ultimately we want everybody to make a choice because you can do it better than we can, really. The STAR Plus enrollment will be effective September 1. People will make a choice this summer. The actual effective date will be September 1.
How many people do you intend to sign up between now and September?
I can tell you just in these 5 programs, I don't have the other data in my head, but we're expecting about 23,000. Okay, see, right here. Okay, let's talk about if a health plan or a managed care organization either reduces, denies, or terminates a service. Okay. They, just like today, you have the ability to request a fair hearing. The managed care organizations are also required to have an appeal process. So what we encourage people to do, or I encourage people to do, is appeal with the managed care organization because they act quickly. If you request a fair hearing through HHSC, sometimes it takes 6 months or longer. So I encourage people to do both because if they don't get satisfaction through the appeal process through the MCO, they still have the backup fair hearing from HHSC. If a service is reduced or terminated during the period of time where that appeal process or they're awaiting a fair hearing, they continue to get the service. So that's just like it is today. The HHSC has an ombudsman office, and this is for complaints that are specific to a member. So your example, they can call this toll-free number. We have been working with the ombudsman office to really get them up to speed on their knowledge of managed care and health care. So there's a toll-free number there. And also, HHSC has a complaint email address, and I'll have to look it up. It's not on here. I thought it was. Where any complaints about a managed care organization can go to HHSC, and HHSC will investigate them. We actually compile a quarterly report of complaints received and those that were substantiated, the type of complaints, and we pass that out at the quarterly stakeholder meetings. So we evaluate if there's one managed care organization that's getting a lot of complaints about medications, for example, why is that particular situation happening? And we have a whole complaint unit that deals with complaints. I would always start with filing a complaint with the MCO first, and then going to the ombudsman if it's specific to a member. But there's also the complaint line through HHSC. So there's multiple ways. But you can change a doctor at any time. But if you want to change a managed care organization, so you've selected one and you don't like it, or maybe you didn't make a selection and we made a selection for you and you don't like it, you can request to change the managed care organization at any time. The effective date is always in the future. So if you make a decision at the beginning of the month, it will be effective the first day of the following month. But if you wait until the end of the month, then it's going to skip a month and be the first day of the month after next. And that's just because the data exchange occurs on a monthly basis and timing is everything. So, yeah, but you can change anytime. I do have a video. I think we've covered everything in the video. Anybody want to see the video?
Yes.
It's about a couple minutes.
Hi, I'm Melissa Gale with the Texas Department of Aging and Disability Services.
And I'm Linda Edwards with the Texas Health and Human Services Commission.
We need to tell you about some changes ahead that will affect how some people who have intellectual and developmental disabilities get their health care.
Beginning September 1st, 2014, additional people who have intellectual and developmental disabilities will begin getting their basic health care, like doctor's visits, hospital visits, surgeries, and medications through the STAR Plus Medicaid Managed Care Program. Now, we call these basic services acute care. There will be no change to how people who have IDD will get long-term care services and supports, such as residential supports, rehabilitation services, and ongoing therapies and services that they require long-term.
Those who are affected will get a letter in early May 2014 from HHSC that looks like this, telling them that they will need to enroll with a health plan called STAR Plus. People who are affected by this change are adults who receive Medicaid but not Medicare and live in a community-based ICF-IID or receive services through one of these 4 programs: Home and Community-Based Services, HCS, Community Living Assistance and Support Services, CLASS, Texas Home Living, or Deaf Blind with Multiple Disabilities, DBMD. So again, you need to enroll in STAR Plus if you are 21 or older, receive only Medicaid, and are in one of these 5 programs.
If you did not get a letter and are wondering if your family member is affected, you can call our helpline at 1-877-782-6440 to find out if you or your family member is affected by the change and needs to enroll in STAR Plus. Or check the HHSC webpage. Click on Medicaid CHIP and then on the STAR Plus message in the upper right corner of the page.
Now let's talk about who is not affected. People who live in state-supported living facilities are not affected by this change. Also, not affected by this change are people who receive both Medicaid and Medicare and live in a community-based ICF-IID or get services through the CLASS, DBMD, HCS, or Texas Home Living program. For these groups, nothing changes.
In addition, there's a group who has a choice. Children and young adults age 20 and younger who receive services in these programs and do not receive Medicare can choose to enroll in STAR Plus, or they can receive services through traditional Medicaid. You can tell if a person has Medicare in addition to Medicaid because they will have a Medicare card that looks like this. The Medicaid card looks like this.
Now, let's take a look at just what the healthcare changes will be for those affected beginning September 1, 2014. That's when some people who have IDD will begin getting healthcare services, often referred to as acute care, through a STAR Plus managed care health plan. These health services include doctor's visits, including specialists, hospital visits, medications, and some other services, such as equipment, home health nursing, or therapies people can get for a short period of time after an illness or accident.
Not all services will be affected by this change. Long-term care services and supports will not be affected by this change, and that includes all those services in a community-based ICF-IID or through the CLASS, DBMD, HCS, or Texas Home Living programs. Long-term residential services and in-home supports will continue, along with all those other services that help a person learn new skills and keep the person active in the community. And the same program providers will continue to provide these services.
The new STAR Plus healthcare services will be provided through a health plan, which is similar to an insurance company. A person who is eligible for STAR Plus has a choice of health plans, and these health plans are required to provide all the same services that are covered by traditional Medicaid. So the same healthcare services these people have been getting using the Your Texas Benefits or Medicaid card will still be covered by the STAR Plus health plans.
And every plan will identify and offer extra or value-added services. Now, these are services that are not available from traditional Medicaid. Some examples may be routine teeth cleanings for adults or sports physicals for children and youth, even membership to a fitness club. And you will have a person from the health plan assigned to you to help make sure that you get the right health care services timely.
As we mentioned earlier, people who are eligible for STAR Plus managed care should have received a letter like this from HHSC in early May 2014. Included with this letter is a list of the value-added extra services that will be offered by each health plan and a link to each health plan's website. These websites include the provider directory, where you can see if your doctor is included in the health plan.
If you didn't get a letter, but you still have questions about whether your family member might be affected by the change, you can contact 1-877-782-6440. or visit the HHSC webpage, click on Medicaid CHIP, and then on the Star Plus message in the upper right corner.
And there are events being held throughout the state where you can go to get help with this enrollment. Those events are listed at txmedicaidevents.com.
And in June, an information packet will be mailed to those who need to enroll into Star Plus. It will explain how to choose the health plan and enroll in Star Plus by the August 15th deadline.
We hope that you have found all this information helpful. Thanks for watching.
Debbie, thank you so much for
Thank
your
you.
time
Thank you.
and coming here. And as your provider, we have your case managers, your program coordinators here. We want to definitely be available to help you guys navigate as best as we can come June when you get your packets. So if we don't have the answers to the questions, we have people that we can call and to certainly ask. So thank you guys for coming. We appreciate your time.